And now at 10:30, as students across the country continue to return to the classroom, millions are missing a vital health resource, a school nurse. The American Academy of Pediatrics recommends one full-time nurse in every school. But a months-long Spotlight on America investigation uncovered a serious nationwide shortage in school nurses, a problem that's even more troubling during a global pandemic.
As national investigative correspondent Josie Sturman reveals, some are calling on the Congress to fix it.
Take some deep breaths.
Elizabeth McDermott has been a school nurse for more than 20 years, but she has no doubt coronavirus has made this past year one of the most challenging.
How much did your workload increase because of the pandemic?
My workload has increased exponentially, but it's just a different kind of work.
Ready?
Work that for her and thousands of school nurses across the country now includes testing students, contact tracing, and infection control. That's on top of first aid, mental health care, helping kids with chronic conditions, and the laundry list of responsibilities that came with the job long before COVID-19.
It's been an overwhelming year, but it's also a year where I realized that my job is more important than it has ever been.
An important job that simply isn't being done in schools across the country because of a nationwide school nursing shortage. Spotlight on America dug into the stats across the country, discovering at least 11 states have dozens of schools with no licensed nurse at all, a minimum of 7 states with no official system to even keep track of school nurses, and only one state in the entire country, Delaware, that legally requires a nurse in every public school.
When school nurses have several schools and they're seeing 4,000, 5,000 students in the course of a week, they're unable to do the work that they know how to do in the way it needs to be done.
Donna Mazik with the National Association of School Nurses says children, education, and public health all suffer when trained nurses aren't in the building. Even when they are, we know they're stretched incredibly thin. In California, our investigation found one county with a ratio of nearly 15,000 kids to one nurse, while the school district labeled the worst in Kentucky was nearly 9,000 to 1. The ratios in states like Wisconsin, North Carolina, and Montana are better, but still show only one nurse for about every 1,000 students.
What's the basis for this?
The basis for this shortage, I believe, is a long-term lack of planning for school health services for students overall. There's no federal funding right now for school nurses.
None.
None.
Do you think states can solve this problem without federal help?
Not currently. States are already cutting budgets. And so when you start to cut an education budget, sometimes you might look for things you think are extra when you have to meet classroom needs. So we want to be sure that they get the funding to do it.
Since 2018, Nevada Congresswoman Dina Titus has consistently proposed grant funding that would help underserved districts recruit, pay, and keep school nurses.
And now that the pandemic is there and schools are opening up, we need nurses even more to reassure students so they feel more comfortable about learning and to be sure that they're getting proper care and assessment, because some of these children in our underserved schools, this is their only source of health care.
Health care that's missing for millions of students at a time when it's more vital than ever.
Give it a push.
I'm Josie Sturman for Spotlight on America.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.